Welcome everyone, and I'm so glad to be here. My name is Dr. Lindsay Harris. I am the president of the Alabama State Nurses Association and also proud member of New Life Interfaith Ministries. Today we have a group that is going to talk to us today about COVID-19 within our school system and within our children. First, I'd like to introduce some special guests. So today we have Pastor George Matthews, and we have a few counselors from the Bessemer City Council. So, Pastor Matthews, I'd like to give you an opportunity to speak.
Thank you, Dr. Harris. We're so proud to have you on board, as well as all of our guests who are joining us this evening. We appreciate you having a heart, as I said off camera, for God's people in general. You're just that kind of person who has a heart for God, and we appreciate you. I just look at the way you serve in ministry without making any kind of noise about yourself. And it is noised about who you are as being president of the Alabama Nurses Association. So thank you to you. Thank you to all of our special guests, our doctors and scientists, I like to refer to it, because these are people who have studied and who are learned in the field of what it takes to maintain our physical bodies as well as our minds psychologically. So the physiological aspects of it and medical aspects of it, we appreciate you, we defer to you, and we thank you so much for joining us. To our council persons, Councilor Matthews, I see has joined us. I think we are going to be joined in a few moments time by a few others, but thank you all so very much. I can't tell you how on board I am with the time that you all are taking to make sure that persons who, parents and concerned others who have children who are re-entering into the school system, as well as the concerned community, we have been spoon-fed with intention on the one hand, and just from on the other hand, those persons who have received misinformation by whatever sources. But I think when we have credible people who have studied the field and in many instances look like us, representing having our concerns, I think we can let go of many of the other the misinformation that we heard. So in a long way of saying it, thank you all so much. We're indebted to you eternally. Thank you so much for this space, Dr.
Thank you so much, Pastor Matthews. Uh, President Pro Tem, Mr. Matthews, District
Yes.
6. I'd like to give you an opportunity.
Well, I'd just like to thank you for inviting me and the other council members. And I did receive a text just a moment ago from Councilor Dawn that she's having some device problems. But in all, we like to thank you for hosting this session to talk about COVID-19, which is really attacking people of color more than you can imagine. One of the Bessemer School teachers, a former co-worker of mine, daughter, just passed a couple of days ago. She's been on the ventilator for about a week or so, and it's really it's real, and we must face it that it's real, and we must educate, and people, our citizens must participate in getting the vaccine. So again, we like to thank you for all that you do, and New Life for the outreach education that they allow to help the people from a physical standpoint, and most of all spiritual. And we just like to say to Pastor George, we thank you and your family for reaching out and blessing the people. And that's what it's all about. You know, it's about the love of people. It's about the love of people. Thank you.
Thank you, President Pro Tem Matthews. And we, as you had mentioned, President Cynthia Donald is having a little trouble, so hopefully we'll see her before the end of the show. And also, we had Counselor Kimberly Alexander. over District 3, and she is, or District 2, and she is unable to make it. And she called me and told me that she definitely wanted to talk, wanted me to share this, that she actually came in contact with a child that was tested positive on Friday for COVID. The child is 5,
Right.
and she's not feeling well today, and she just had her second vaccine. So we're definitely praying for her that she feels well, and that the children and anyone that has been in contact with that child is well as well. So now we will get to we'll get started. So I'd love to introduce our guest and the expert, the scientist, as Pastor Matthews just mentioned, is Dr. Kalila Brown. Dr. Kalila Brown, she is the Child Health Medical Director over the Jefferson County Department of Health. She is an internist as well as a pediatrician. So she brings a wealth of knowledge. I've had the opportunity to hear her speak at other forums, and very knowledgeable. So, Dr. Brown, we thank you so much for being here. We're matching, so we had our. But thank you so much for being here. And what we'll do is just take questions. So for those on the New Life page and those on Jefferson County web page and the Facebook page, please, if you have any questions, put them in the chat and we will receive them and we will ask Dr. Brown. Our goal today is to just to talk about, kids going back to school. What are some of the parameters? What should I be worried that my child is going back to school? Which vaccine should my child take? Can they take more than one vaccine or any of the vaccines? So those are some of the questions, plus any that you all have. So Dr. Brown, can you start off just talking to us about COVID and where we are in general, and then specifically in children?
Okay. Thank you, Lindsay, and thank you, Pastor Matthews, for having me. So with COVID in children, contrary to popular belief, COVID does affect children. Thousands have been infected in the United States. We have had hundreds, unfortunately, die in the United States. Globally, 1.5 million children have lost their primary or secondary caregiver to COVID, and that is huge. Unfortunately, that means we've got 1.5 million essentially orphan children in the last 18 months due to COVID. And then we look at what's going on with things like, the mental aspect of undergoing quarantine or having to do virtual school. And all of those things will impact our children for a generation. So I think it's really important that we have a conversation around what we can do for our children, around the safety of vaccinating our children, and understanding that our children make up a large portion of our population. And so in order for us to reach the herd immunity that everyone hears Dr. Fauci talk about, how important it is going to be for us to vaccinate our children for COVID-19 in order to reach herd immunity.
So, Dr. Brown, one of the first questions we actually have from the audience is, what can we do to protect our children that are under the age or that are unable to be vaccinated at this time? And what age can children be vaccinated?
Okay, so there's one vaccine that is approved for children 12 and up currently, and is the 2-dose Pfizer vaccine. You receive your first dose, and then 3 weeks later, you can receive your second dose. 2 weeks after that second dose, we would say then you're fully vaccinated. But for those children who cannot be vaccinated at this point, the most important thing you can do as an adult, as a parent, a teacher, anyone who's around children, is for yourself to be vaccinated. That's the best way to protect these children so that they never come in contact with the virus. Beyond that, you want to make sure that if they're 2 and older, they're wearing a mask, that you're teaching them about socially distancing, which can be very hard for our children. So we really have to model that behavior ourselves. And then we're working with things like hand washing, keeping your hands out of your face and your mouth, things just general hygiene.
So you mentioned something about mask. Is there a mask mandate? Should we mandate it within our school systems?
So we currently do not have a Jefferson County mask mandate. When it's mandated through the health officer for Jefferson County, it essentially becomes everyone in Jefferson County. And right now, because we have vaccinated population and unvaccinated population, and there's a lot of other dynamics around, that decision has not been made. Now, that does not preclude a school system from mandating masks. That doesn't preclude a business in Jefferson County from mandating their own mask. And it definitely doesn't say to parents that they should not have their children in a mask. At this point, it's just not mandated for the entire county based on what's going on within the county. But you have to look at what's going on within the safety of your home and what's best for your child with where they attend school and the environment that they're in.
Now, I know you work, you work with the pediatric population for the most part, but what is it that we can do to encourage our parents or our caretakers, I should say, to either help the kids, wear more masks or get our children that are 12 and older vaccinated?
Again, I just say it goes by example. It goes by leading by example. Being vaccinated as the adult in your household, wearing the mask as the adult in your household. Despite being vaccinated, I wear my mask everywhere I go that's outside of my home or outside of my closed off office. Even when I'm within the health department, we are all back to wearing our mask, mostly because the Delta variant has shown the ability to have some breakthrough infection. And although because I'm vaccinated, I may not get very sick, I could definitely pass that along to someone else who either is unvaccinated or who's unable to get vaccinated. There's certain populations based on health, they're not able to have the vaccination. And then again, our children who aren't old enough to get vaccinated. So we want to make sure that we're taking every precaution, not only not to get the virus ourselves, to be good stewards and good community members and not pass that virus along to someone else.
So we have another question. So there's been talk about a vaccine coming in September. So what are your thoughts on the safety of that for children ages
So
5?
right now, Pfizer and Moderna, both vaccines that we've been using since last year in adults, have both submitted to the FDA and the ACIP, which is the Committee on Immunization Practices, to be able to begin giving vaccines to children 6 and older. Where that is in the FDA, I'm not exactly sure, but they have had that data for some time, and hopefully we will see a recommendation within the next month or so.
And so in your thoughts, do you think it'll be safe for children to receive those vaccines?
So everything that we've seen with our vaccines, with Moderna, with Pfizer, they are completely safe and effective in our children. One of the things I tell people is if you look at the statistics, you are more likely to be struck by lightning than you are to have a vaccine reaction. So you throw out all of these numbers for people, and that doesn't mean anything. But think about how many people do you know have been struck by lightning? So being able to put that in perspective into something that's palatable for people, that's easy to understand, I think that speaks volumes. And so, we have to do what we have to do. The only way we will end this pandemic is to receive enough vaccines to get us to 80-85% so that we basically stop the spread within our community. So there's no more viable host for this virus to live and grow and replicate in. That's how we stop it from changing. So, now we're on the Delta variant. There is also a Lambda variant out there. There's other variants that will come as long as we continue to allow this virus to circulate. A virus it's a predator. So it wants to continue to live. And so what it does is it goes into hosts and it continues to learn and adapt and figure out how best to survive. And so that's why we're seeing these variants and why they're changing and why Delta seems to be more severe than the prior variants or the original strain of COVID. And so what it wants to do is survive. What we have to do is cut off its ability to survive. And that means that we have to stop giving it hosts to replicate in and passing along to other people. So that's really what herd immunity is about. I liken it to the fact that my generation, everybody had chickenpox. It was just something we dealt with. We passed it around. It was in your classroom. If you got it at home, usually your mom made you play with that sibling who had it. it so everybody would get it, but it was a pain, and it was an awful disease. And when you get it older, it's actually can be pretty severe. There were children and adults who do die from varicella, but my children have no idea what a case of chickenpox looks like, and that's because we vaccinated and we obtained herd immunity. So it's no longer circulating within our community on a viable basis. Every now and again, you may see it pop up here and there in a population who's either unvaccinated, or you may see it in a child who maybe is immunocompromised and is unable to mount a good immune response. But that one for me, I think, is a great example of how vaccines work and how they can be safe and effective. And literally, the next generation will have no idea what a disease looks like because we vaccinated the prior generation.
That was great. That was great. I have a question there. You mentioned something about mask, and that, you all at the Jefferson County Health Department, you all still wear your mask even though you're fully vaccinated. If I'm not mistaken, on the CDC website, it states that if you are fully vaccinated, you do not have to wear your mask. What are your thoughts on that?
So, definitely, if I'm in a room, a smaller room group with fully vaccinated people within my household, or a small group session, I don't wear my mask. But when I'm out and about, when I'm in other places, I don't know your vaccination status. We don't wear it around our neck. We're not going around asking. And so, I wear my mask so that, I don't unintentionally come into contact with someone who may or may not be vaccinated. We definitely don't want to discriminate against anyone, or have them feel singled out for not being vaccinated. Because again, we have children who are too young to be vaccinated, and we still have those immunocompromised people who are unable to be vaccinated. They want to be safe as well. So I do still pose a risk to them. Our Moderna and Pfizer vaccines are about 95% effective, but there's still a 5% chance that you could be carrying around COVID and not know it, or have mild symptoms. But when I give it to that unvaccinated person, they could get gravely ill with it. So again, it's just part of me being a good community member, a good citizen, a good Christian, to wear my mask and protect my neighbor.
That's right. So we have a question from Miss Law. She said, with a child with kidney disease, can they go to school, or should they stay home if they've had both shots?
So I tell everybody to go and talk to your pediatrician or your provider that knows your case specifically. Everybody will be a little different where you are on your immune spectrum, what medications that you're on, and how that can affect your reaction to COVID, and how it can affect your immune response to the vaccine. So everybody should be a case-by-case basis if you have some type of medical reason that you're concerned about. So definitely go and talk to your provider. The fact that you've been vaccinated is great. That means you do have some level of protection, but based on your medications that could suppress your immune system, that will make a difference on what your safety and your risk level will be.
This next question is a really good question, because I've heard it so many times. Is evidence that the vaccine can have adverse effects on pregnant women or unborn children?
So there's absolutely no evidence that shows that. On the other spectrum of that, we do have a lot of evidence that shows children being born to COVID positive moms getting COVID. And so that is a huge concern. We also are concerned about when moms get COVID when they're pregnant, the same way we are when they get flu. We want to make sure that our moms are protected as much as they can be, because they, again, are essentially the host. They're growing a person inside of them. And so their health is of the utmost importance. It's very vital. And so when your immune system is compromised, when you aren't able to take in fluids and the appropriate nutrients, that can affect the growth and development of your child. And so you have to look at what your risks are. Our data shows us that there's no significant risk from the vaccine, but the data shows us there's very significant risk from getting COVID while you're pregnant, or having an infant get COVID.
And Dr. Brown, I'd like to add, I do know this, that when they were doing the studies for the vaccine early on, women did get pregnant while they were in the study. which does give us some evidence that it's not going to affect, the child, the unborn child, or the woman. So you can still get pregnant. So please don't think that you're going to use this as a birth control, because it will not work.
Correct. Correct.
Let's see, we have another question. So why are so many people dealing with COVID who are fully vaccinated? That's a very good question.
So again, with the Delta variant, it is very, very infectious. And so we have to remember that nothing's 100%. And so even with your vaccine, again, if you remember, you got Moderna or Pfizer, we talked about it's 95% effective. So you do still have a small risk of getting COVID. So now that we have the Delta variant and the amount of circulating virus in our community is so large, you're likely coming in contact with it on a daily basis. So if you come into contact with someone relatively close to you, so let's say you're a teacher in a school and you're trying to give a lesson to a student and you're working with them one-on-one in math and we're pretty close, you definitely can get enough of that viral load to become positive. Now, what we have to remind people is that the vaccine isn't just about preventing you from getting COVID, it's about preventing you from getting severe disease or hospitalized from COVID. And that in the data from those 3 vaccines have been amazing. So if you do get COVID, typically you have a mild case of COVID. So it's much better for you, but you do have to remember that you can still pass it along to someone else. So you still need to quarantine. That's the importance of wearing your mask until we can get our levels down in our community of this Delta variant and potentially stop COVID from mutating. We're just going to have to keep the mask on.
Dr. Brown, I know some of the parameters maybe have changed. I know we still wash our hands, wear our masks. What about the distancing, social distancing inside versus outside, or is that still the same?
So the CDC is still recommending 6 feet of social distancing, 3 feet in schools. You really want to try to do that as much as possible. Again, when you're outside of a setting where that everyone has been vaccinated, or the health of everyone in your area. So when you go out into the grocery store, to any outside of events where there's lots of people, I still wear my mask. When I'm in an indoor space, I also wear my mask when I can't account for the number of people who will be there and the vaccination status of the people who will be there. That's vitally important. I will say, though, with the Delta variant, that there is some evidence that shows, although we talked about the 6 feet in 15 minutes is what we've been telling people. Really, the data showed for a long time is that was what the amount of exposure you really needed to have to pick up COVID. There is some evidence with the Delta variant that because the viral load is so high, there are cases of people being infected with COVID with an exposure that's been less than a minute.
Wow. So tell me, we have heard lots of myths, and I think that's one of the reasons why we're on here. So I have heard that they are the government, I should say, putting a tracking device like in us, and that's why there has been some hesitancy. What are your thoughts on that?
Yeah, definitely not a tracking device in the vaccine. That would be really, really hard to do in a frozen liquid vaccine that's a 0.5 or 0.3 mLs. Never heard of anything of that nature being done. But I think what's important for people to know is the technology of this vaccine is not new. This technology is 20, 30 years old. You need to understand that COVID there's multiple strains of COVID, just like there's multiple strains of flu. And so with the SARS end of that, the vaccine or the vaccine type, the mRNA vaccine type has been studied for over 20 years in a lab. It's just we never had a proper disease that would fit this type of vaccine. So really, to me as a Christian, I say God provided for us before we ever knew we were going to need it. That to me is just miraculous that someone has been in a lab for 20, 30 years investing in this technology, never knowing when we would need to have it. But we get into a pandemic that's killing thousands of people, millions of people worldwide, and we're able to produce a vaccine in less than a year. never been done before, but it's because all the work had been preloaded, had already been done. So at this point, we just had to plug and play the particular algorithm for this virus in order to have the vaccine and replicate it. It's absolutely amazing to me that was able to be done. But again, it was we happened to be in a position because the research had already been done to do this. So when people talk about it's brand new, no, the technology isn't brand new, just the virus is new. And so the vaccine now has the ability for us to use that virus in this vaccine or that algorithm to then be able to utilize this vaccine type.
So you mentioned something about this being an mRNA vaccine. So
Mhm.
does that have anything to do with our DNA? Does it change our molecular um, inner being? Does it change our bodies?
Absolutely not. mRNA is messenger RNA. Basically, it gives a message. And so it basically helps your body produce antibodies. So it gives it the code, it gives it the message on how to produce the antibodies to this virus. It doesn't change your DNA. It doesn't change anything within your structure. What it does is it tells your immune system what to do. Just as when you get the virus, that's what happens is your immune system, those cells come in and they come in contact with that virus and they begin to mount a response and learn and figure out a way to produce a proper immune response. So the vaccine just basically tells your body how to do that without having to be infected with the virus.
So we have another question. It says, I've heard that each shot has a number on it to track. So what is that number used for?
So no, that number is what's called a lot number, and that's on every vaccine that we give anywhere. So every vaccine that I give in my clinic to any child has a lot number. My nurses are required to record that lot number and that expiration date. Just as if you look on a bottle of Tylenol or aspirin in your medicine cabinet, it also has a lot number and an expiration date. Anything that we have like that will have a lot number and expiration date. So if there is a problem with something, they find that the storage was improper or it had been handled improperly or manufactured, something that happened in the process, that they can pull that lot number. So they can pull anybody who had that lot number and notify them. And so, like I said, that's in anything you have. If you pick up your Tylenol now, you're going to see a lot number and expiration date. So if Tylenol had a recall on that, you would be able to go to your medicine cabinet and say, okay, I have this Tylenol. I need to call this number and find out exactly what I need to do. So it's not tracking you, it's there for your safety. So for some reason you receive something that, like I said, wasn't handled properly or stored properly, they know exactly how to find you and get you what you need.
That's a good question. So with all things being considered now, everything that's going on, what is the best way for churches to reassemble?
So, I'm actually going through that with my church as well. I'm in a pretty large congregation as well. And we've talked through that through the last 18 months and just been vital, especially for our population as African Americans, because this virus has hit us so hard. We're doing the best we can with grateful for platforms like this where we can still meet and get our word and get filled every week. But I would really say, you've got to look within your congregation. Smaller congregations are a little bit more adaptable because it's fewer people, less risk. Whether or not you choose to assess your vaccination status or not, that makes a difference. But I would definitely say making sure that you're masking, that you're social distancing, and that you're asking any parishioners if they have any signs to stay at home. If they have any reason to believe that their immune system is compromised and they may not mount a good response, that we find a way to continue to feed them and serve them outside of the church house until we get to a point that we can do this as safely for our population as possible.
So Ms. Rutledge just said, thank you for the session. And you mentioned generally, speaking, 6 feet distance is suggested, outside, but why is there an exception for inside or for the schools at 3 feet?
So for the schools, there's a little bit of a difference. Number one, it's really difficult to social distance 6 feet within schools. And the data from last year showed us that our smaller children tend not to circulate the virus as effectively as larger people. Now, whether or not that's still true with the Delta variant, we're not sure. We're still looking into that. But with the original strain of COVID, that is what we found. Partially that's believed because children are smaller, and because this is a respiratory virus, it's much harder. I have, as a child, they have smaller lungs, a smaller respiratory system. So they're able to push that virus out a lot at a shorter distance than an adult. And then again, they tend to be smaller, so the height difference between a child and adult is very different. So for a child to be able to give it to an adult, you really probably need to be closer to kind of eye level. And so again, the children just were not circulating the disease as well last year. Mostly that elementary school age, so children 11 and under tended not to circulate it as well. And so the data showed us that as long as they were masked, and that we were using proper respiratory hygiene, keeping our children home when they were sick, we really kept our levels really low last year. And that wasn't just for COVID, that was for strep, that was for influenza, that was for RSV. We just didn't have sick children last year because we took all of the precautions to keep respiratory illness down. So like I said, whether or not that's going to be true for the COVID variant this year, we're not really sure. But we found that the risk versus reward for keeping our children in virtual school really was not there if we made sure that we had the safety measures. Because we've got to balance that with our children having mental health issues and severe school lag, and understanding that children learn and develop by associating with other children. It's natural growth and development for them to associate, for them to play, for adolescents to get together and group and do the things that they do. That's all part of their growth and development. And unfortunately, COVID took that away from them. And so we want to make sure that we're balancing those things for our children. So we found a way to have them in school and keep them safe if we follow those protocols. And so we can do that again this year, as long as we, parents are quarantining when they've been exposed. They're quarantining their child when they're symptomatic. If they've got a fever, if they've got a cough, runny nose, keep them home. I know it's difficult, but you would really be, again, a good community member if you did that. In Texas, a parent sent a child last week to school, knowing that they were positive. They had been positive, received their test results 2 days earlier, and exposed 80 children. So that's 80 households who now have to take off, hope their children don't get sick, but have to go get their children tested, have to quarantine for 14 days. And there are some of us who have the benefit of having sick leave and have enough sick leave to take that. There are a lot of our families that do not receive sick leave. And so when they don't go to work, they don't get paid, and they don't have an income to feed their child, to pay their bills. And so that's just really hard. And so as a parent, we want to make sure that we're taking good care of our children, but we want to also make sure that we're not endangering other people's children. So this virus is one of those things that we have to think about our neighbor. We have to care about our neighbor. It's the only way we're going to get through this is together.
With Pastor Matthews asked the question earlier, but I'd like to ask, for schools that are reopening, are there any special considerations, like should we continue taking temps? I know we should wear our mask and wash our hands and the 3 feet, but should we continue taking temperatures when our students come in, etc.? Are there any type of extra precautions that you feel like our school system should be doing for our children to protect our children?
I would not say extra. I will tell you, our school systems did a lot of work last year. They did an excellent job last year. A lot of work by our nurses, our administrators. They were on calls with the health department, calls with the State Department of Education, calls with ADPH, with the state health department. Every time something new came out, they were attending meetings and getting updates and changing their plans to make sure that it fit. They put in a lot of extra work last year, but they did an excellent job. They proved that it could be done if we followed the guidelines. And so we're just asking schools to continue to follow those guidelines. Now, again, if you have a child that has a special case, if they've got cancer or they're immunocompromised, schools may not be the proper place for them. Again, that risk benefit kind of thing there that you've got to weigh individually for your child. But for the vast majority of children right now, being in-person school, mask and social distance is what's best for them.
So for those that may be positive, for students that may be positive, do you think there should be a protocol established when and if a student who has contracted the virus in their classrooms, like should they be shut down and reopen? Any policies or protocols based upon that?
So there is actually a protocol. ADPH puts out what's called a back to school toolkit, and that's what the school nurses have been learning and reviewing with ADPH since we allowed children to go back to school. And so ADPH revises that every time there's an update or something from the CDC. And so you can actually find that on adph.org. Anybody can go out and look at it, but it's what our school nurses are following. And so it's asking us to social distance at least 3 feet, when possible, 6 feet, for children to be masked, for anyone who is unvaccinated who's exposed to be quarantined, anyone who's symptomatic to be quarantined. Now, what it does say is if your child is exposed but vaccinated, they do not have to quarantine. They can stay in school until a time that they become symptomatic. So if they never become symptomatic, they don't have to go home, again, because they've got very good protection and are very low risk from COVID. If everyone in the classroom or the area of the exposure is masked and has at least 3 feet of distance, we no longer have to send those children home either, because we know that the risk is much lower for COVID to circulate in that classroom. So that's a shift this year for our classroom. That allows us to keep children in school so that they're not having to go home and quarantine. The data shows us that we can do that safely, which is why wearing a mask at school is so important. It doesn't just keep your child from getting COVID, it also keeps your child from having to quarantine when they've been exposed, which is huge for a parent who has to take off to take care of that child, or for a child to miss 14 days of in-person instruction.
Thank you. I'm gonna just stop for a second and just tell you, Dr. Brown, this is awesome. This information is so vital for our community, and we appreciate you so much. And for those that are watching on the New Life Interfaith Ministries Facebook page or the Jefferson County Health Department or Department of Health Facebook page, please click like, please share the information. This is vital for, our pastor says that, we're reaching Bessemer and beyond. So we want to do this. We want to continue to do this and to share this vital information for everyone. So please, please, please click like, click share. And so we'll continue. So one of the questions that I did have, so we're going back to school. We know that we're still during COVID, but a lot of parents, especially for our younger children, did not allow their younger children to receive their regular immunizations. Partly because doctors' offices weren't opened, or they were just afraid to take their children to get their regular immunizations. Can you speak to that?
Yeah, that's something I've been working on diligently since we've really started our back to school push in July and August. Nationally, our immunization rates, our routine immunization rates for our children is down 14% nationally. For measles, mumps, rubella, it is down 20%. That's huge. That puts us below our herd immunity. So if you remember, back in 2019, there was an outbreak of measles in New York in a population of children who were not vaccinated. And it was pretty significant. It was pretty severe. Also spread to California, Washington State, Texas. And so we had a lot of concerns, and we actually went into incident command structure here in Alabama around that, because there are children who either aren't old enough to get vaccinated, or again, could not be vaccinated against measles because they were immunocompromised. What we don't want to see is that while our children are dealing with trying to stay safe from COVID, that we have put ourselves in a position that they can now be exposed to the other 14 vaccine preventable diseases. So we need to make sure that our children are getting in and getting those routine vaccines. And then once they're eligible for the COVID vaccine, to get that. We don't want to have to fight this battle on two fronts. We don't want to fight COVID and measles. We don't want to fight COVID and varicella. We want to avoid our children being exposed to things that we can prevent while we're working on the things that we need to get rid of COVID.
What is the rate of survival for kids? The one thing that I do know is that a high percentage of those people who are unvaccinated, they make up the population that have been hospitalized, that and that even have died. I think I heard the other day it was like 87% nationwide. At first, it was like 99%. So it's a extremely high percentage. So what about for children, as far as their survival rate or their outcomes after having COVID and even being hospitalized? And where are we here within the hospitals? I heard that in, I think, Memphis, their hospitals are full with, with children, and they don't have anywhere else for the children to go. So where are we here in Alabama?
Okay, so from the standpoint of children with COVID and death in children is really, really rare from COVID. But I can tell you that secondary effects, children do get long COVID. We do have children who are in the ICU intubated from COVID. We have children who have had MSIC, MISC, which is an immune system response. Typically, a few weeks after having COVID, they can mount this kind of hyper immune response that can cause long-term and debilitating issues. We've also had children who have developed aneurysms in their heart from COVID. I was on a session with a doctor from Children's who spoke of a 2-year-old in our area who now has to deal with aneurysms from having COVID, and so it does happen. While it can be rare, I tell people when it's your child, it's your one and only, it's your everything, and so we've got to make sure that we're protecting them as much as we can, because this virus does not discriminate, and so thinking that we can just surround them in a certain population and these people don't look sick, that our children will be okay. That's not necessarily the case. We've got to mask, we've got to social distance, we've got to have good respiratory hygiene, and then we've got to vaccinate when we can vaccinate. So that's why I say it's very important for parents to be vaccinated. You never want to come home from work and bring home something to your child unknowingly. And so we've got to make sure that we're taking all of those measures because we don't want our children to have to deal with the repercussions of this disease for potentially a lifetime. And something like aneurysms in the heart is definitely something that will be a lifetime battle. So from that standpoint, you had a secondary question about children. Tell me exactly what your question was again.
So I think you answered it. I was asking you about the rate of death, and where are we here in the state as far as hospitalizations?
So our hospitals are definitely filling up with the Delta variant, and you've probably seen a lot on the news about bed alerts in our hospital and hospitals having to open up extra COVID units, similar to how we had to do last winter. This time we are seeing more children infected with COVID. Last time it seemed like COVID was pretty mild on our children. Children's of Alabama was able to maintain. But I will tell you the situation that they're reporting now is we're seeing RSV in the summer. It's just something we typically don't see. We see it during the winter. And so we're seeing this surge in the summer, partly because we wore masks last summer, so we kept our rates of RSV down. Once we took these masks off and began kind of going back out and going to community events and going on vacation, we allowed RSV to come back around. And so now that we have a lot of children who weren't exposed to it for a year, they don't have that immunity that they typically would have. So we're seeing it circulate a lot more. So Children's has a good number of RSV patients that they're already taking care of. So then you couple on top of that the Delta variant in children, and they are seeing more cases of that. We could potentially see ourselves in a very dire situation within our children's hospital. You have to remember that Children's of Alabama is the only children's hospital in the state. And so they get children who are gravely ill from all over the state, and sometimes Mississippi, Georgia, from other places, because we just have such excellent specialists here. And so, we've got to do what we've got to do in our community. The last thing we want to do is run out of beds for our children, but understanding that we're not just fighting COVID, we're fighting those normal routine things that affect our children that we have to hospitalize them for as well. So we've seen their numbers. I think A couple of months ago, they were maybe at 5 children with COVID. Maybe 4 to 6 weeks ago, they reported this week that they're up to 22 children with COVID. And that's concerning. So if you've got a child who's 12 and up, who's eligible to get the vaccine, I implore you to please talk to your provider. Please get your child vaccinated if they're eligible for the vaccine from their health standpoint, so that we can get them protected and fully vaccinated.
Thank you. Ms. Deborah Lindsay, she asked, are there mandatory guidelines for vaccines for school? Are they still in effect?
So there's not any mandatory vaccine guidelines for schools. Those would be set by employers, so your school district, or something of that manner. And I don't know of any that have a mandatory vaccine policy of right now. But we are just trying to make sure that we're educating not just the community, but our teachers, our healthcare providers, our frontline workers, those that are out who work in restaurants, who work in service industries that are exposed to the public routinely, that we're making sure that we educate them and we give them all the opportunity that they can to be vaccinated.
Okay, so Ms. Tiffany Sneed said she's read that there have been multiple reports of myocarditis and pericarditis after a COVID-19 vaccination, particularly in our younger kids. So can you address that?
So we did look, the CDC did look at that through the summer over some reports of myocarditis, typically in adolescent males. Somewhere between the age of 16 and 24 is typically where we saw it. But I believe it was less than 100 cases. But if you look at the rate of myocarditis after receiving COVID, it's way more. And so your child's risk of getting COVID and having myocarditis is significantly more than it would be from getting the vaccine and getting myocarditis. So if you're going to take a risk, I tell people you take a calculated risk. You know what you're getting from the vaccine. You would be monitored. We would know very early on to then get in and treat you. But getting COVID and then developing myocarditis may not, because again, parents aren't looking for that, especially if they have an asymptomatic case of COVID. You wouldn't know until they begin getting symptomatic. The good thing is even the children who had myocarditis from some type of immune response from the vaccine, they did do well. They were treated with the typical methods that we treat myocarditis and did very well and recovered from the myocarditis.
So if someone has contracted COVID and they've done their quarantine, what processes should they go to as far as cleaning? Is there any particular cleaning methods that they should use as far as cleaning their house and protecting from contracting COVID again?
So when people are exposed to COVID, I encourage them to try to limit their interactions within their household, to try to limit their exposure within their household, especially if you have children or other adults in that household. You want to try to quarantine away from people as much as possible, especially your loved ones. So if that means somebody bringing your food to your room and you eat it in your room, is it very isolating for 2 weeks? Yes, it is. But that's what we have to do to make sure that we keep the rest of our family safe. If you live in a household alone, then that's a different story. But you want to maybe look at someone dropping your groceries off or having your food delivered to your doorstep. So again, you're not going out and exposing other people. And then I just encourage people to continue their kind of routine cleaning. We all started off COVID with lots of Clorox wipes, lots of Clorox, lots of Lysol. I'm just really trying to make sure that we're keeping our environment as clean as possible. So I encourage people to continue to do that. And then anything that you've slept on, that you've laid on that can be washed, you wash those things, in hot water and your routine detergents, and that should take care of it.
Can you please speak to, we'll go ahead and ask this question. So should parents of much younger kids hold off on getting vaccinated if the vaccine becomes available?
I would not say that would be my recommendation. We've been holding, these vaccine companies have been holding trials and testing this vaccine on children for a good long time. Back in 2020, they started giving this vaccine to children. So by the time it becomes available for our children, thousands of children will have received this vaccine and been followed and have done well. So it's not like your children will be the first ones to receive this. We've had people in our community, people throughout the United States who have felt the need to contribute towards learning about this vaccine, and their children wanted to be a part of making sure that their classmates and other American children are safe. So they volunteered to go and participate in the studies for the vaccines, and it's been proven to be safe and effective. That data has been, like I said, sent to the FDA. We're just waiting on full approval.
Yeah, can you speak a little bit? We've seen some that people are, they're waiting until, I shouldn't say waiting. So they've contracted COVID, gone through all the symptoms, and now all of a sudden it's like they're in dire need of receiving the vaccine. What are your thoughts about that?
So yeah, part of that is because the beginning of COVID 18 months ago, we talked about when you contracted COVID, you built up natural antibodies, and we weren't really sure how long they lasted to prevent you from getting COVID again. Well, now we are seeing a significant amount of COVID re-exposure of people who previously had COVID, and now they're getting COVID again, especially with the Delta variant. So it's really important, even if you've had COVID before, if it's not been, a month or so ago, you really should consider getting vaccinated, because we don't know how good your immune response is. Again, when you get natural COVID, we don't know. We don't have studies that really show us what each individual person is going to do with that, with their immune response. How much were you exposed to, and how well did your body take care of it? How much immunity did you build up? We can't do individual studies on each person's body, but we do have great studies on the vaccines that show us over thousands of people how good the immune response is for the vast majority of people. And so we know that it works. And so you need to go out and get vaccinated when you're eligible for the vaccine. That's going to be your best opportunity to prevent COVID, and definitely to prevent hospitalization and death.
So we have a few more questions and only 5 more minutes. So I am going to read. Our next question is, what are some of the best ways to keep our immune system strong in the way of vitamins or supplements?
So, living a healthy lifestyle is going to be what you need to do now. I've said it over and over and over again. Get vaccinated, wear your mask, social distance, make sure you're using good respiratory hygiene, just generally. And then also doing the things that we talk about to be a healthy individual. Are you eating a good, healthy diet? Are you drinking lots of water? Are you getting good, healthy exercise? Daily vitamin is great for everybody for the most part. So taking a great just general once a day vitamin. And then there are other kind of specific things based on your age group and based on your potential disease processes that you may have, that other supplements that you may be recommended to take by your provider. But just doing those things that we've talked to children about since they were very young, those things that we know to do. If you would do those things, eat healthy, get those nutrients in, drink your water, and do the things that we know it takes to stay safe from COVID, that gives you the best chance that if you are exposed to COVID or anything else, to be in a position to fight it off.
So, Mr. Loach Alfred, she just had a very good comment / question. So we do understand that the mental health of our kids, with depression and, anxiety with everything that's going on with COVID. So in your opinion, do you think that the push for schools to be face-to-face is the best decision, or virtual? What do you think?
So based on where we were with the start of school and where we are right now for the Bessemer area, I still do think that face-to-face instruction is what's best for our children to start with. We will watch it. We get data on a day-to-day basis at the Jefferson County level, at the state level, and at the national level. And so if we get to a point where we find that it's not safe for our children to be in school, I'm sure that our state health officer and our local health officer will then say that. They've been in close contact with the superintendents, with the State Department of Education, making sure that they have the information. They're talking to the specialists in our area, our immunologist, who know COVID, who have studied COVID for the last 18 months, and making sure that they're following their recommendation along with the CDC. But right now, we're able to social distance, wear that mask, do the things that we know work. And so it's very vital for our children to get as much face to face instruction as they can get this year, because we know that there were deleterious effects of them not having face to face instruction. That we will have to work with for years, making sure that our kindergartners who didn't have face to face instruction, it's very hard to learn to read when you don't have a teacher who can be there to help you with those sight words. It's very hard to teach math and other things for children who may or may not have the things at home to supplement them. So we want to make sure that our children are given the best opportunity to be healthy and successful as they grow and develop. And so right now it is face-to-face instruction is what's best for right now, but it is a day-to-day thing that we're looking at. And if we find ourselves in a position where that's no longer the recommendation, you definitely will hear it.
Well, Dr. Brown, I'd like to thank you so much. I mean, we are, so grateful here at New Life, here at the Jefferson County Department of Health, to have you to help us in this endeavor. Your information that you gave us tonight was very, very informative. I mean, we have so many comments on, thank you for the session. You're a wealth of knowledge. So we really appreciate that. And we hope that people will share this video with everybody, with your friends and family, because it is something that we all need to learn, and we need to hear good educational based, science based information. And Dr. Brown, we thank you for that. So it's right at 6:30. So we did a great job. You did a great job. Thank you so much. And for Pastor Matthews, as well as President Pro Tem Matthews, thank you both for being here. And we hope to have more of these soon, especially as the demand comes. But thank you, everyone. And we'll say good night.
Thank you all.